Okay, in this one, it says we're looking at treating heart disease. It says a study reported looked at people treated for heart disease and reported lower death rates for those who received a coronary bypass, CABG, compared to those who received a stent. A stent is a device to keep blood vessels open. Okay, and it gives the abstract, and it talks about identifying patients with heart problems, and they were either given stents or coronary bypass, and we want to know was either the bypass surgery or the stents are greater. So the key here is that patients were given stents or bypass surgery. Okay, and we saw what happened was those with stents seemed to have higher rates of adverse effects, adverse outcomes. Okay, but in this case, was this an experiment or an observational study? Okay, the answer was that it's an observational study. Okay, when this research was done, we were just looking at historical records. Okay, we looked. It says they looked at people who at patients between 2003 and 2005. Or 2003 and 2004 who received treatment between and the researchers conducting the study did not say give this person a stent and give that person a bypass surgery. Okay, did not decide who got stents or bypass surgery. Okay, so that decision whether to get a stent or a bypass surgery was probably made by a doctor or the family or the person, the patient themselves, him or herself, and not done by the researcher who's doing the study. So there could be all sorts of there could be confounding factors. And so we cannot make any kind of conclusion regarding whether one causes better or worse outcomes. Whether stents or bypass surgery causes better or worse outcomes. Okay, so for all we know, maybe the doctor who decides whether to give a stent or bypass surgery, maybe bypass surgery is a little bit more risky, and so they're unwilling to perform the surgery on old or feeble patients. Maybe the stent is an easier procedure, and so by that virtue, the feeble patients, the ones who are a little bit weaker, may be recommended to get stents rather than bypass surgery. And so whether they got bypass surgery or stents or whatever, just the fact that it was an older feeble patient may make them more likely to have an adverse outcome, and it might have nothing to do with the treatment itself. At this point, the observational study is interesting, but we cannot use it to make any kind of conclusions about whether one treatment is better or worse than another without doing some kind of controlled experiment.